how can I get into that category? How can I change my behaviors, my chronic loading throughout the day, the way that I move throughout life in order to get rid of my symptoms? Welcome back, everyone, to another PT Pro from the Optimal Body Podcast. I'm Dr. Dom.
I'm DocJen.
And today we're going to be talking about spondylosis. What is that? Why is it causing pains in our neck and our back? Should we be concerned about it? And ultimately, what to do. All right, so spondylosis is another one of those words or buzzwords or diagnoses that ultimately means back pain, or we are having some sort of back or neck symptom. So excited to kind of dice into that and what it actually means. But before we get into that, please consider hitting the subscribe and notification bell so that you're always up to date on the new videos that we're coming out with, the podcasts that we do together, and the videos that Jen comes out with that are just incredible about movement, diagnoses, different pain disorders. Also, comment below. Are you dealing with this? Have you heard, oh, you have spondylosis? Or do you just have back pain in general and have other questions that we might be able to address?
Spondylosis. Excited to dive into this one because I think we're just going to help to continue unpacking, one, what these scary diagnoses mean, what the MRI image might mean, and what you can ultimately do about it, right? That's why everyone comes to the podcast. What can I do about this? But we hopefully first want to help you to understand it, because understanding something is going to really play a role and have a huge impact on how we respond to it.
Yeah, and just to start off, spondylosis, again, it's another one of those words that kind of lives in the medical realm that we don't actually know what it means. And again, osis, how it ends with osis, basically just means abnormal. Sponda or spondy means spine. So the word itself kind of just means abnormal spine.
But it sounds a lot scarier if someone comes in and gets an MRI and gets that diagnosis, right? And ultimately, what we're diagnosing, or what they're diagnosing you with when they say that, is they're just really describing natural age-related degeneration of the spine, particularly around the discs. But that, again, is a natural age progression. And we've talked about this on other podcasts as well.
If we image our spine over a lifetime, there's going to be changes, regardless of if we're having symptoms or not. You know, our spine's going to look different when we're 20 and when we're 45 and when we're 70 or 80. Yeah. So again, there's this natural progression just within our physiology where we're going to be losing moisture and hydration in our body or of our discs, and our bones are going to look slightly differently because of the chronic loading that we do over life. And there are cases in which we'll see this natural degeneration happening a little bit faster than, quote, normal, where there might be trauma. Like if you have trauma to your spine, if you're involved in repetitive activities that are going to be loading your spine in certain manners, or in the athletic or sports or athletics realm, you're going to see this in rugby players or American football players, soccer, horseback riding. Again, if you're doing these things that have this kind of repetitive loading, especially if you have impact or chronic impact trauma, that might be something that will cause us to see this spondylosis maybe at a slightly faster progression. But again, not necessarily meaning it has to be associated with pain.
25% of people, no pain, get an image and have these changes within their disc. And then that continues to increase. So about 50% of asymptomatic people will see disc changes on an MRI when they're above 40 years old, and then 85% of people over the age of 60. So 85% of people, no pain, who get an image of their spine and see these degenerative changes happening, but yet have no pain.
And the reason that we bring that up is because okay, we'll be having back pain or you'll be having neck pain. That's the important thing to you as the person. Like, I'm having pain, right? And then what happens when we go to a hospital or when we see a specialist, they take the image and they want to tie, oh, here's how your image looks. You have spondylosis. And then that is what immediately makes this connection in our head. Like, oh, that's why I have pain. That is the specific reason that I have pain. And the reason we like to bring up these studies with asymptomatic people is to show that there are so many people who have no symptoms that have images that look just like yours, if not worse. And so again, how can we separate ourselves from saying, my image looks like this, that's why I have pain, and say, oh, wow, there's so many asymptomatic people that have similar images. How can I get into that category? How can I change my behaviors, my chronic loading throughout the day, the way that I move throughout life in order to get rid of my symptoms? Because clearly there are people that have this on their image that don't have symptoms. I want to be a part of that group. When we start talking into this a little bit more, it sounds very similar to different diagnoses, like you mentioned, spinal arthritis or degenerative disc disease where we just see changes in the disc. We might see associated bony growths or osteophytes, very similar to arthritis. And so for that reason, we can approach these in similar ways.
So we have to just be able to change up, okay, how am I loading all throughout the day, kind of like what Dom mentioned, and how can I start to change that up a little bit more? The one thing that we always are looking at, and we've talked about this before on other podcasts, is that posture itself isn't bad, right? So loading itself isn't bad. We're going to load the spine. The moment we get up out of bed, we're loading the spine. It's how are we doing that throughout the day, and are we always sustaining in one load or one forward position, one posture all the time, or are we dynamically changing it up and giving that body a different response and a different ability to feel and start to load in different ways?
Because also we know that as these discs change, the outer portion of the disc, which is called the annulus or the annulus fiber, is like this fibrous sheath around the outside of the disc, and that's where a lot of the nerve endings live. And as we know in a lot of other nerve disorders, even like sciatica, anytime we lose space or anytime we lose ability for those nerves to feel like they can move a little more freely, they become a little more sensitive.
Yeah.
They get a little more sensitive to any sort of input. A lot of the times when we're dealing with chronic pain disorders, we talk about them like hypersensitivity disorders. So if the nerves in our back, our annulus fibers, have less hydration and we're getting a little bit of that shrinkage, the nerves can't move as well, we're going to see that hypersensitivity. That's really what we're battling against, not the fact that the disc is dehydrating itself or we're seeing different degenerative changes in our spine. Again, maybe if we start loading differently, we might slow down progression of that stuff.
Potentially.
But we're really fighting long term against this hypersensitivity of the nerves in our back. 33% of people who are having symptoms believe that getting surgery would be more effective than physical therapy itself. But there was a meta-analysis done that showed that 84% of people who did more conservative methods, including physical therapy, changing the way they move, doing some different rehab programs, 84% of those people had positive outcomes in their pain and in their function.
I mean, and that's like one of the first places I've gone to with patients, and I can even remember talking to several friends where this has been a repetitive pattern where people say, oh my gosh, my pain, I realize now that my pain came on when I broke up with my relationship, or when the significant life factor happened in my social life that really impacted my physiology and the way that my body responded. And so I got severe neck pain, or I got severe back pain, or I can now look back and understand that this stressful event really impacted and had a significant role when I was having that pain. And I think that is the most important thing to start to even acknowledge and look at in your life. And it doesn't even have to be a big stressful event, but what are the little stressors that are happening on a day-to-day basis, and what are we doing? Like, are we controlling those little stressful events to be able to impact our overall healthy life?
So what do we do?
Right.
Phase 1, as in many things, it's about calming things down and finding ways to put less physical stress in that area, if we're talking like from a purely physical standpoint. So calming things down, how can we make the core or the neck feel safe? More specifically, going to be focusing on the low back, because especially in spondylosis, a high percentage of them happen actually at L5 to S1, which is right where bottom of our lumbar spine goes into our sacrum or our pelvis. So calming things down, finding that stability and that dynamic stability in the core. Breath work is one of the first places we always go with many other things. So even laying on your back, taking deep breaths, finding that breath in the low rib cage where you can expand in the low rib cage, and then find that low rib cage kind of tightening down as you exhale. Even putting pressure on that low rib cage with your hands or wrapping a band around your ribs can really help you find, okay, that's what it feels like to activate and get real, true diaphragmatic breaths.
When we're talking about this baseline core, we can't forget that, especially because the majority of people are getting pain and these diagnoses at L5S1, well, that plays into the pelvis, right? So the pelvic floor has to play a role in your core interaction. And obviously, I mean, we go through this in a lot more detail in the core plan on Gen Health. So if you wanted somewhere that gave you a baseline as to understand this foundational stuff and then progress into it, we do that on Gen Health. But in general, when Dom is talking about taking that big breath around that rib cage, you also want to think, okay, if I breathe in my my rib cage expands, my diaphragm drops, my pelvic floor should be able to relax as well. Okay, so everything kind of expands. It's not just the belly breath, but it's really like an expansion and a length through that pelvic floor as well, which a lot of people don't have even that awareness factor, right, of what that really means. And then on the breath out, you should feel a significant change, not in your pelvic motion, but in that ability to pull that pelvic floor up and in toward your rib cage. So everything is kind of compressing down toward each other. And what people end up doing sometimes is they over grip in that upper ab region rather than using that transverse abdominis that wraps around the core from the pelvis and that pelvic floor. So we really want to integrate that deep core relationship before we start to say, okay, how is my pelvis moving? How are my glutes, activating and all these other things? We want to get back to that baseline stability because this is where it tells our brain and our system that we find safety is if we have this proximal control, which is our baseline, which is along our spine. So when we have this control along our spine, well, then we have more distal ability to move and feel safe in those movements when I move my arm, when I move my legs, when I go to do more dynamic type movements. So really in this phase 1, we're talking deep core interaction, really feeling that, understanding that, and then being able to move into muscle activations, which we show a ton in Gen Health as well, right? So that could even be like your heels on a surface and you're just trying to contract down and feel your hamstrings, not even lifting into a bridge, but just feeling these little things start to fire, a side clam, really understanding the positioning of your body to fire into those glutes. Like these little isolated movements really give us better awareness and control of our body so we feel like we have the purpose in moving forward.
And I would even say like you could start with upper back mobility. If you're laying on your side and just doing a basic open book, that's still a pretty stable position where you're not doing a lot of movement through the low back, but you're going to start to open up that thoracic spine, which we often say if you're having pain in the low back or in one area, look at the areas above and below. So thoracic spine mobility and hip mobility would be huge. That's kind of the last part of phase 1 is just doing general mobility that's going to help unload the back. So doing mobility at the hips, getting internal and external rotation, which you can do lying on your back. You can do it actively just by holding underneath your thigh and moving your hip in and out. That's going to help actively activate those hip rotators, but also help you understand, oh, this is how much hip rotation I have. Feels a lot tighter or a lot more difficult on this side. Maybe I should work on that side more. So basic unloaded spinal mobility and just general mobility of the areas around the low back.
Yeah, and always making sure, if open book hurts, you're only moving within your pain tolerance. So phase 1 is really like, what is my pain tolerance? What do I have the capacity to do? And can I move within that range? And then when we go into phase 2, now we want to start to integrate it. Okay, we've isolated a lot of movements. We've done, this isolated core, mobility, strength stuff. But now how do we make that into more functional movement? And that's where we do want to start loading the body a little bit, within tolerance. So maybe we're starting to stand a little bit more. We're starting to do more functional movements that include a little bit of rotation, a little bit of squatting, lunges. We're starting to integrate into movements that are going to be used in everyday life. And again, done in a way that your body and your system can handle.
And this doesn't have to be anything crazy. Like if we're talking functional integrated movements, just like squats, lunges, stepping up or stepping down, things that you do every day. So if you're going to go into a squat, holding onto a chair, a table, the back of a couch, and just slowly lowering into that squat and then using whatever you're holding onto as much as you need to come back up. Because again, we want to promote safety in these movements because this is generally once we're doing these things in our everyday life where suddenly we put our body in a position that doesn't feel safe and then we have a flare up of that pain. So how can we do it in a more controlled environment to start integrating some of that great core control and mobility we worked on and activations that we worked on in phase 1, but do that in a nice slow squat? Same with a lunge, holding onto a chair or something in one hand. How can we slowly lunge down, let our knee barely tap on the floor, and then come back up? And as you get used to these things, then it's about coming back up a little bit quicker, but with a little more velocity. Again, nothing that's gonna make you feel unstable or unsafe, but slowly lowering down and then coming back up a little quicker. Same with like a step up or stepping down from a stair, holding onto a railing. You can just do this on a stair in your house. Hold onto the railing and step up and then slowly step back down with nice, good control, focusing on keeping that core nice and stable. Same as if you're stepping down, slowly stepping down as if you're going downstairs forward, slowly stepping down.
And then we go into phase 3. That's essentially, our return to sport. But for a general person
Return
who
to
isn't
life.
Exactly, a return to activity, right? So we're now saying, okay, what are our movements in everyday life, and how do we start to integrate that into an exercise program that feels good? So if I am bending down and having to rotate, doing laundry or picking up a child, how am I kind of putting my body in positions that are going to offset and carry a kettlebell on one side, where I'm having to bend down and pick it up and then carry, right? That's going to be groceries. That could be a carrier. That could be just different things. We have to start to put our body in these different loads, because that's how we're going to desensitize the system, so it's not going to freak out on us every time we do it again.
Yeah, pushing things, pulling things, carrying things, all of these different functional activities, where by the time we're in phase 3, we're trying to start loading up a little bit more. We're trying to push that top end of the resilience of what our back is going to be used to, so that when we do encounter those challenges or tasks in everyday life, like suddenly picking up a 40-pound suitcase to throw in the back of the car, our body's a little more ready. Like, okay, we've trained for this.
Exactly, because we have to realize and remember that our back doesn't improve by staying in a neutral position. Like, we will rotate through life and we will move. And that's why there are even studies now that show that bracing, honestly, had no significant difference. Like, it didn't really help anything at all. In fact, it could also promote fear. So we don't necessarily need those intense braces, maybe at the beginning, if that's the only thing that's getting you through work or through, whatever it is. But it's ultimately not what's going to move us forward. We need to rotate through life, and we need to not be afraid to move our spine, to bend, to extend, to rotate. It's natural and normal to get into those positions. And in fact, like we said in the very beginning, right? If we're always staying in one spot, that's where it's going to put the most compressive load. So we need to be able to offset and load the body in different directions. And I did just want to touch a little bit on like the surgery aspect. We're not against surgery. It's necessary. It has its role, specifically if we are talking about things that are causing neurological changes within our body. So if we're having a loss of sensation, if we've tried conservative treatment and it continues to get worse, if we're feeling
losses in strength, tingling, different reduction in muscle mass on one side versus the other, if you're just having symptoms on one side, any of these different neurological signs, which if you're experiencing those, you should definitely be working with somebody else. That's where surgery might be a little more prevalent or necessary in order to make some progress or offload the pressure that's on those nerves.
Thank you so much for joining us on another episode. I hope you learned a ton and hopefully have some tools to help you feel empowered to get back into your body. And if you wanted to check out any of the programs on Gen Health, we'll link up the free week. You could try a free week. You could check out any of the programs. We have 11 different plans available on the platform. So a ton to choose from and a ton to keep learning from.